Good morning to our media partners, CHDs, and everyone who's watching on YouTube. I am Jolo from the DOH Communications Management Unit. And in our Kapihan today, we'll have a discussion on COVID-19 case trends. And we hope to clarify, talaga bang bumababa na ang COVID-19 cases sa ating bansa? So, here with us today is Dr. Althea de Guzman from the DOH Epidemiology Bureau. Dr. Althea, morning po.
Morning, Jolo, and good morning again sa ating pong mga media partners. I'll just start sharing my screen. Okay, so kamusta po ulit ang ating COVID trends itong nakaraang linggo, specifically sa ating NCR plus areas at ang ating mga iba't ibang island groups. So pasimulan ko po sa mga mensahe nito. Over the recent 2 weeks, we showed a decline. So the 2-week growth rate was negative over the recent 2 weeks. Kaya lang kung titingnan natin mamaya yung ating epidemic curve, mapapansin natin na mas madami pa rin mga kaso na nakikita tayo nitong mga nakaraang linggo kumpara doon sa peak na natin noong nakaraang taon. More granularly, may tuloy-tuloy naman pong decline na nakikita sa NCR, pero talagang yung term natin ay siya ay posibleng tumaas kasi napakanipis ng pag-decline na napapansin natin. Nakita din natin para sa rest of Luzon na kung ano ang muka ng epidemic curve or pattern ng NCR+, sinusundan niya actually. And then panghuli, ang Visayas at Mindanao regions natin ay nakakakita na tayo nung nagsisimula mga senyales na nagde-decline na siya nitong nakaraang linggo. Subalit, pagdating sa ating mga deaths, datapot nakakita naman tayo ng declines, hindi siya as continuous or as marked as the decline in cases. Ang napansin natin, nung tayo ay nag-peak nationally in terms of deaths, at yun ay dahil sa peak in deaths in the NCR plus areas, habang bumababa ang mga deaths sa NCR+, ganun din naman na parang tinapatan siya ng pagtaas ng mga deaths sa mga Visayas, Mindanao, and rest of Luzon areas natin nung ang mga kaso nila ay nagsimula na rin tumaas. Natapansin din natin ang mga lugar kung saan ang mataas or yung pagdami ng mga deaths ay sustained pa, ay ito rin ang mga lugar kung saan na nakakita tayo na napupuno ang ating mga hospital, lalo na ang ating mga ICU beds. So this is the data we reported last week. What I need to point out is the change kung saan ba nanggagaling ang mga kasa natin. It used to be that it's NCR 3 and 4A that would be in the top regions. Right now, si NCR ay hindi na po kasama usually as a top 1 region, and it's usually region 4A. And then we have regions outside of the Luzon area among the top regions na natin. And even in the top areas where we are reporting these new cases, it's not usually the NCR 3 and Calabarzon areas, but also the provinces and cities outside of these areas already comprising our top areas. Ito po yung ating latest na 2-week growth rate and ADAR na analysis. At makikita natin dito na ang Philippines po ay nagkaroon ng -9 na 2-week growth rate. So, though mababa siya, ito po yung sinasabi namin na manipis yung -1, 2 hanggang around -10%. It's very prone to sudden posibleng tataas, So, kailangan palakihin pa natin yung pagbaba niya. Subalit, dahil negative ang ating 2-week growth rate at makikita naman po natin na ang ating ADAR ay naka-moderate risk na at 5.42, the risk classification nationally is already at low risk. Subalit, nakakita tayo ng 4 na rehiyon kung saan high risk ang classification, at yun ay ang regions 11, 6, 12 at ang region 8. Sila ay mayroong mga positive 2-week growth rates and high-risk ADARs. Isang rehiyon din kung saan tayo nakakita ng pagtaas ng mga nire-report na kaso nitoong nakaraang 2 linggo ay ang Region 7, where there was a 21% positive 2-week growth rate. Subalit ang kanilang ADAR, kung makikita dito, ay hindi pa po kasi high risk, no? 4.93 lamang siya. Kaya ang kanilang risk classification ay moderate lamang. Kasabay ng pagbabantay natin ng kaso ay yung ating H-curve and ICU utilization. So may pagganda, no? Pag-improve sa H-curve sa ngayon, wala po tayong high risk na mga lugar in terms of their healthcare utilization. Subalit, meron tayong 3 rehiyon kung saan ang kanilang ICU utilization ay high risk na. At yun ay nasa Region 11, Region 6, at Region 2. Dito makikita natin na kung pagbabasihan natin ay ang dami ng nare-report na mga kaso nitong nakaraang linggo kumpara sa previous na linggo, bahagyang tumaas, no, at 5,772 versus the 5,638, no? So makikita dito sa bar graph na to na kumbaga meron pong napakababang dami ng kaso nung nakaraang linggo at ngayon ay dumadami uli, pero yun nga po, no, it's around 100 cases more than what we reported last week. At ito po yung nababanggit ko na kung titingnan natin yung epidemic curve natin, and we included, no, this red line here to show na we have actually improved a lot from a peak of more than 10,000 cases daily. But we have seen slight rises, no? Ito pong dalawang bar na to na tumaas above the 7-day moving average noon pong dulo ng Mayo, at ngayon ay meron pa pong pagtaas hanggang unang linggo ng Hunyo. At kung titingnan natin, no, yung peak natin last year, hindi pa tayo nakakabalik doon, no? So we need to, I used to say na let's go for the December, January na levels. Probably it's good to go na bumalik nga po tayo, no, dun sa average natin, yung peak muna natin last year, and then we can go and further decline from there. Makikita din natin na ang NCR, which are the blue bars, are not really the ones contributing already to our cases, no? It's the areas outside of NCR, Region 3, and Calabarzon, which are taking up a larger proportion of our new cases. Dito, pinakikita din natin ang trend na the NCR plus areas are the ones showing the lowest, no, na cases. Ito ay mas madami nakita natin sa other areas, pero sa ngayon nga po nakakita tayo ng either plateau tulad nitong para sa rest of Luzon natin, no, after a decline, itong red line, ngayon medyo nag-flatten siya. Ganon din po actually sa Visayas at Mindanao with a slight upturn, no? Kung titingnan nyo po dito sa Visayas, yung pinakadulong portion ng aqua blue or aqua green line ay bahagyang tumaas po siya, no? At dito po sa line graph na to, pinakikita natin kamusta ba tayo last year. No? Interestingly, the peak last year was really mostly driven, no, by NCR and the plus areas shown here as the aqua blue and the green lines. Yung ibang mga lugar, ang peak, no, yung pinakamadaming kaso nila ay hindi nga halos naabot yung peak ng NCR plus areas natin. At halos wala ngang peak tayong napansin kung ikukumpara natin doon sa NCR plus. It was really this year, and particularly, no, for Visayas and Mindanao this June, na nakita natin tong mga peaks, no, in cases. So itong orange at itong aqua blue line ngayong Hunyo, and for the rest of Luzon, it actually matched, no. Ito yung sinasabi ko na yung mukha niya ay nakikisabay, no, parang kahalintulad po siya ng mukha ng epidemic curve ng ating NCR plus areas. And this is why we are closely monitoring all areas in the Philippines. Yan, for several reasons. The decline is not as fast as it used to be reported previously, and we're seeing some plateaus. And secondly, much higher cases being reported, especially for Visayas and Mindanao, and any sign of decline is a bit more recent and should be still observed, no? Kung siya nga ay magtutuloy-tuloy na decline. Kung titingnan po natin, bumaba naman na po yung mga flag areas natin. Dati nagre-report tayo ng 33 or 34 na flag areas because of their high risk, 2-week growth rate or ADAR, and an equally high risk age curve or ICU utilization rate. So from these naging 21, so balit binox namin dito in red yung mga lugar na kailangan tuloy-tuloy pang bantayan ng dahil sila yung mga lugar na nung nakaraang linggo ay nandito na rin po sa ating listahan, no? Nakakakita pa rin tayo ng pagtaas, no, ng kaso sa iilang lugar o di kaya posibleng medyo bumaba ang kanilang kaso tulad ng sa Cagayan, Bataan, Naga at Iloilo as well as Lucena, Cotabato at Pateros. Subalit ang kanilang HCUR and ICU utilization ay naiiwan pa pong high to critical risk po. Dito naman sa table na to ay mga lugar na fina-flag namin dahil ang kanilang pong ADAR or 2-week growth rate ay nasa high risk, no? So balit ang kanilang HCUR or ICU rate ay nasa moderate risk na lamang po or low risk na lamang. Nakita natin yung ilan dito na mga lugar ay galing doon sa unang listahan natin, no? So ang Bohol, Jensan, Apayao, Butuan City, Surigao del Sur at City of Makati ay nakakita ng pagbaba, no? Pagbagsak na kanilang HCUR and ICU utilization to either moderate or safe levels na po. At itong huling table naman po ito ay mga lugar na ang kanilang case classification ay low risk na lamang po, no? Subalit nananatili pa rin pong mataas ang kanilang healthcare o di kaya ICU utilization. Subalit yung mga nakabox na ng pula ay nakapagpakita po ng improvement naman po, no? Ng either tuloy-tuloy na pagbaba ng kanilang mga kaso or bahagyang pag-improve lalo na po doon sa kanilang healthcare utilization rates. Tingnan naman po natin ang NCR kung saan ang ating average daily reported cases is now slightly higher at 694 in comparison to the 686 in the previous week. Kaya we often describe the trend of NCR as fragile, no? This is a crucial time for NCR because we don't want, no, it going up again, no? Yung mga slight rises can be managed, but we don't want that slight rise to become another fast na transmission or increase in cases. And looking at our NCR areas, meron na lamang tayong tatlong cities po na naiiwan na ang ADAR ay naka-high risk. Subalit lahat po ng ating NCR areas ay may negative 2-week growth rate na lamang po. Pero at nakita natin, no, medyo lumaki na po, no, yung pagbaba ng kanilang mga reported cases compared to last week, no, mas malalaki na po. It's around more than 10% na decline already, and it would be Pateros and as well as Marikina na around 6 to 10% na lamang po ang decline, no. Nakita natin na ang Pateros sa ngayon ay merong high risk na HCUR at 75%. At si Las Piñas na lamang ang naiiwan na ang ating ICU rate ay nasa high risk. Sa plus areas, no, at na-report nga ng ating spokesperson na yung ilan sa plus areas ay iniwan po natin sa heightened general community quarantine. At ang dahilan doon ay ito, no? Nakikita natin sa Laguna ang pag-flatten and then another increase in the reported cases. At si Cavite is this again very erratic trend na bababa, tataas. Ngayon po nagpa-plateau na po siya. Si Bulacan ay tuloy-tuloy ang pagbaba, subalit si Rizal ay tinitingnan namin mabuti dahil after a continuous declining trend, meron po siyang bahagyang pagdami ng kaso nitong nakaraang linggo. Naiiwan po ang Laguna as high risk at ang kanyang pong 2-week growth rate ay positive pa at ang kanyang ADAR ay tumaas pa po, no? From just 7.74 to 8.24. Subalit ang magandang may re-report natin sa lahat ng ating plus areas, lahat ng HCUR po ay nasa safe zone na. Nananatili na lamang na sa Laguna at Cavite ang meron tayong moderate risk ICU utilization rate. Na quickly, lingnan natin ng Luzon. lahat ng lugar ay pababa na, subalit ito ngang nakaraang linggo ay may bahagyang pagtaas dito po sa Region 1. Ito po yung blue line. Ang CAR, ito po yung green line, no? So meron parang upward, no? Parang pitik pataas po doon. At yung 4B natin po, no, represented here by the orange line. Para naman po sa Region 7, karamihan naman po sa dalawang rehiyon ay mas may marked na decline na pinapakita, tulad ng Region 6, ito pong pinakamataas. Ang Region 7 after a decline ay parang nagpa-plateau or nagpa-flatten na naman po. Subalit ang Region 8 ay mukhang patuloy pa po ang pagtaas ng kaso, no? And lastly, para po naman po sa ating Mindanao, ang mga rehiyon ay pababa na po ang mga nare-report na kaso, pero ito pong Davao, itong red line sa taas, medyo erratic pa po, no? So this decline we saw in the last week, we hope will be something na dire-diretso po at masusustain across the next week. At sorry po. And then I'll just look some additional info on our deaths, no? So nakita nga natin na parang step ladder, no, yung pagbaba ng ating deaths. But we have seen our average deaths decline to just 64 from a peak of 123 deaths per day, no? Pero kung makikita natin, ang ganda ng pagbaba ng NCR, which is the blue bar, pero sa ibang rehiyon, hindi ganon kabilis, no? Kung titingnan natin sa table na to, hinighlight namin in pink areas na biglang dumami ang deaths either across April and May, but these increases in deaths were sustained over June. So yung pagtaas ng deaths ay ito po ay kaakibat, no? It parallels the increase in cases in these areas. However, for NCR, we saw a rapid decline in deaths over a month. So in these areas, gusto nating bantayan, hindi ganoon kadami, no? Kumpara po sa nakikita natin sa NCR, kung saan pumalo tayo ng 1,200 deaths, no? Sa ibang mga lugar, maliliit lamang po. But these small numbers contribute when taken as one. At kung makikita natin dito sa second to the last column, ito rin ang mga karamihan sa kanila ay mga rehiyon na ang kanilang healthcare capacity ay napupuno, no? Lalo na ito yung ating ICU beds, no? Ito yung palaging pinaaabot ng ating kalihim ng ating ICU beds are the life-saving beds. And our regions are working hard to ensure that some of these already have moderate risk levels already, or some have gone down to high risk levels na lamang, pero gusto natin, no, mapababa pa siya to safe zone. So I'd like to end with this, no. We're more than a year into this response, and right now we're in the process of reviewing our strategies, no. And very important for the national government is we'd like to really, no, having a part of a good response is national government has its clear outcome and operational goals. At atong mga goals na ginagawa natin ay ka-align, no? Doon sa goal natin din na magkaroon tayo ng safe at sustained na reopening ng ating sectors sa ekonomiya. Ayaw na nating magsiso from ECQ, MECQ to GCQ, then go back. And it really entails the term safe and sustained, safe na opening ng ating sectors. At tayo'y nakikipagtulungan with our economic sector for that. Pero para maging sustained nga po ang ating reopening, ang kinakailangan talaga natin ay itong mga gatekeeping indicators and strategies na to. And it's really the MPHS, our PDITR, and we see, no, the big role of our regional IATF and task forces in overseeing and leading the call, no, and the coordinated response among its LGUs. At ikatlo pa rin, no, sa ngayon, tayo ay merong tuloy-tuloy na ginagawang sequencing. Sa ngayon, wala pa tayong nade-detect dito ng mga na local case ng Gamma or Delta variant or even the Delta Plus variant. We haven't detected it yet. And we see that as attributed, no, to a stronger border control. The border control is there because it buys us time, no? Para siyang lockdown eh. It shouldn't it is something that we want to slowly loosen. But the loosening And the strictness in the border control is there because they want to buy us a bit more time. Cases are still high, and we don't want the entry of these variants of concern to push our cases again, no, to levels na ma-overwhelm na naman ang ating health capacity. And ikalawa, also bias time to push pa, no, padamihin pa, palakihin pa yung coverage ng ating pagbabakuna. So, thank you, and we'll be more than happy to entertain your questions.
So from the presentation of Dr. Thea earlier, we can see that the cases in national cases is slowly declining. But of course, mas gusto pa natin yung pababain. And in order to lower our cases and lessen deaths, especially in NCR, we have to be not complacent with our status now. So in order to lower our cases, the public should continue practicing the minimum public health standards, such as wearing a face mask, face shield, physical distancing, and ensuring there's enough airflow when inside enclosed spaces. And of course, LGUs should strengthen the implementation of the PDITR strategies. And we have to work together to hopefully knock out COVID-19. So for the open forum, let's have Red Mendoza first. Red?
Hi, good morning. Good morning again, Doc. Of course, as always, it's always a pleasure to ask questions. First clarification lang po. Sa Davao kasi, according to Dr. Yumang, may Delta variant daw doon. Can we clarify that po muna? Kasi sabi ni Dr. Yumang daw, nakamute po kayo.
Wala tayong locally reported na Delta variant na kaso. I will have to check, Red, baka she may be referring to an ROF na pagkatapos ng isolation ay maaring bumalik sa Davao, no? I-check na. I'll get back to you on that, Red. Pero
Okay po.
I can confirm we have no local case of Delta variant.
Okay. Una po, doon po muna doon sa border control. I mean, it's the big it's a big natin, yun yung isa sa malaki nating kailangan to prevent the entry of the Delta variant. Ngayon nga po, I think a few days ago, the IATF went to Cebu to discuss nga yung kanilang border issues. And again, Governor Gwen has already stressed out na gumagana daw yung kanilang system doon sa Cebu. As much as na pinaliwanag na ni FTD, ni Secretary Charlie, ni Dr. Salvana na yung 7-day testing is more important. Ngayon na ganito na hanggang ngayon nagmamatigas pa rin ang Cebu. Sabihin na natin Cebu kasi other border areas naman are I think following naman the IATF rules. Pero yung Cebu talaga yung sabi nga ni Governor Gwen, test case daw to eh. How can we be able to assure the people na walang makakapasok na Delta variant? Kasi alam naman natin na the Delta variant is very much, sabi mo nga, time will tell na nga lang eh. I mean, buying us time na lang po yun eh. So, how can we resolve this issue once and for all? Kasi if there's someone na mag-test ng Delta variant and mag-lurch sa community, we may end up like being Australia. Yun lang yun.
Salamat, Red, no? And that's also, of course, the concern of government, no? And that's why we emphasize that siguro number one, no, we do recognize the best practices of our LGU. And when Cebu presented, they really had good practices. And one of that is the command and control of the response. But what the IATF wanted to put across is the border control is not just a local issue. It's a national issue. And that is why the experts and IATF is stressing the need to have aligned uniform border control policy, international border control policy. Ngayon, as to what IATF or the secretary will do in response to the recommendation, no, and to the proposal of Governor Gwen, I think that's still being studied, no, para tingnan nga their recommendation is try it out in Cebu. They have good monitoring at the LGUs. We'd like to be able to study that. But right now, the stand and the recommendation is we need to implement the existing national protocols for quarantine in our international borders.
And last question na lang po siguro. You said nga po na the situation is still very much fragile dito. Not just in NCR but also nationally. Kasi, yun nga, nagsisiso nga yung kaso. How can we, paano natin ma-assure yung mga tao na kasi right now, they're all thinking na pag biglang tumaas ang kaso, Delta variant.
Hmm.
Yung mga ganong spikes na issue na baka sabihin nila, baka may Delta variant. I know it's understandable, like allows the people to be more vigilant, more active, ika nga. Pero of course, we can't possibly discount the fact na baka nando na rin yung fear ng tao na baka pag nagkaroon ng sudden spike ng kaso, baka Delta variant na yan. So, how can we resolve this kind of issue na baka yung mga tao mas lalo pang matakot na baka yung the next few days, few weeks, baka magkaroon ng spike ng cases and could be attributed to the Delta variant and all.
Okay. Alam mo, nung pumasok or nagkaroon ng concern on SARS decades ago, I feel so old. Ang isang naituro nga sa amin ay, alam mo, okay lang matakot, no? Pero wag tayong magpanic, no? Because the hindi tayo magpapanik kung alam natin, and salamat, ito yung opportunity na magbigay tayo ng information, no? So there is a fear for Delta variant, but pwede nating i-manage yung fear na yon at yung takot na yun kasi alam natin the strategies work, no? If we comply, if we adhere to our MPHS, the risk of us getting any of these variants of concern will be minimized. If we get ourselves vaccinated, we are steps ahead of also getting any of these variants of concern, no? At kakibat doon is yung hindi lang yung individual na ginagawa natin, kailangan, no, kapartner natin ng workplace natin, ang ating LGU, so that their own role here are also just as effectively implemented, no? So siguro nakakapagod mang pakinggan, pero ito talaga, no? Bago tayo magpanic, ito muna, magmask. Siguro bago tayo magpanic, magsuot tayo ng mask. Tama ang pagsuot ng mask, mag-face shield tayo, i-practice natin yung protocols. It does work, and it really limits, no, minimizes our chances of getting infected or even infecting others.
Okay. Salamat po, Doc. Salamat, Jolo.
You're welcome, Red.
Let's have the next question from Caroline. Caroline.
Good morning po, Doc Thea.
Hi, Caroline.
Doc, first question lang kasi napansin ko po, ang laki po nung binaba nung testing rate natin from about 300,000 in the previous week. Parang last June 27 or 28 ata, 187,000 individuals lang yung na-test. Ma'am, possible po ba na mas marami pa talaga yung cases because mababa yung testing? And what is the reason po bakit biglang ang laki ng binaba po ng testing rates?
Thank you, Caroline. No? So yan yung minomonitor natin. I think it was 2 or 3 weeks ago that I shared. Tinitingnan namin kung baka antigen testing yung nakaka-contribute dito, no, sa pagbaba ng kaso. A certain small proportion, yes, no. I think around 60,000 individuals were tested using antigen. Pero alam niyo, napansin namin sa NCR Plus kung saan dun tayo namigay ng mga antigen tests, they still preferred using PCR testing, no. Siguro it's really because it's a confirmatory test. It's something they're used to. And at the same time, no, hindi kasi natin nasi-sequence yung mga ina-antigen testing lamang, no. So, nung ating tinitingnan, so kung ano pa yung ibang mga dahilan, ang report naman ng ating LGUs ay yung pagbaba kasi mostly sa NCR area, no. So, yung pagbaba ng output natin is correlated doon sa pagbaba din ng mga bagong kaso, individuals, close contact na nahahanap nila, and as such, no, mas kaunti rin yung natetest natin. So, in a way, it aligns with the narrative na we are really seeing less cases, confirmed cases, because we're also seeing less suspect cases, symptomatics, and close contacts in the ground.
Ma'am, sorry, just to clarify, ang ibig niyo pong sabihin, kaya medyo lumaki yung binaba, Kasi PCR test lang po itong nandito sa tracker. Hindi po kasama dito yung antigen test.
Yes, pero kahit na isama natin ang antigen test, hindi rin naman malaki yung maidadagdag niya. So after many half months, the report we receive is they tested around 60,000 individuals. So that's just 1 day's output usually. So it shouldn't and it didn't contribute significantly to the decline in lab output na nakita natin. Ngayon, nakikita natin na ang decline ay dahil doon sa mas kaunti na talaga, no? Yung suspect cases, symptomatics, and close contacts na nahahanap natin. Kaya wala na rin tayo o nababawasan talaga yung mga kinakailangan nating i-test.
Ma'am, last question na lang po regarding po dun sa death rate. Nakita ko, nakalagay po kasi dito, mataas pa rin sa Region 2, Region 6, and then Region 11. Pero bumaba po dun sa mga ibang areas. Ma'am, may correlation po ba yung vaccination rate dito sa death, sa pagbaba ng deaths? I mean, mas mababa po ba yung nabakunahan dito sa areas na mataas pa rin yung deaths? Tapos kaya po ba bumaba dito sa mga ibang areas dahil mas mataas na yung vaccinated population? And since last question, ma'am, baka pwede mag-request po sa DOH na makapagbigay po ng breakdown ng antigen and then PCR test. Thank you po.
Sige. To answer, no, so yung antigen again, I think I referred to para nga po ma-share natin. Pero when it comes to vaccination, that's very interesting, Caroline. That's something we're actually studying. I think DG Eric reported a few days ago, no, kung ilan nga yung deaths among the vaccinated and comparing it to the deaths in our general population. At the EB, we want to also compute, no, what we are asking for is a list of the vaccinated individuals from DICT para mag-compute tayo yung tinatawag natin. How many deaths have we really prevented, no? Because of the vaccination. Sa ngayon, apologies, hindi kita masagot kung dahil ba sa bakuna kaya mas kaunti ang deaths sa ibang lugar kumpara sa ibang mga rehiyon. Intuitively, based on studies, yes, no? Kasi that is the purpose of our vaccines, prevent severe critical disease and fatalities. Pero yung tawag nating real world, ano talaga yung status sa Pilipinas, yan yung kinakalap natin ng datos. And once we have completed and vetted that analysis, we'll be more than happy to share with our media and public.
Thank you po.
You're welcome.
Let's have the question from Gerard Naval from the chat. Please elaborate on your statement that it is a crucial time for the NCR, considering you said that the case rate is growing po.
Yeah, it is crucial because, pababa naman ang kaso ng NCR, no? Nakikita natin yan. Pero ang term ko, manipis, mabagal talaga, no? I always relay na in that very slow decline, magkaroon lang tayo ng isang super spreading event. Posibleng papalo na naman tayo pataas, no? Hindi natin biniblame ang pag-open ng ekonomiya dito. Kasi alam mo, hindi na natin pwedeng isarado ang ekonomiya. Ngayon, the challenge is while we open up our economy, we have these safeguards. Tayo personally, workplaces and LGU. So, kung ma-maintain natin ang ginagawa natin ngayon, lahat ng ginawa natin nung naka-ECQ tayo at MECQ, yung pagdidisiplina natin, tuloy-tuloy po at baka mas mabilis na pagbaba pa ng kaso ang makita natin.
Okay, for the next question, let's have JC from TV5. JC.
Okay na. Baka nasagot.
Okay na. Let's have Kat Domingo next. Kat.
Good morning, ma'am. Ma'am, what's so peculiar with Laguna? Bakit siya na lang po yung napag-iwanan sa plus areas?
Magandang tanong yan, Kat, no? We have actually referred this to our regional office and to the ILG, no? Sa tingin ko in this response, kung nakita nyo yung pinakita kong last slide, napakahalaga na even though we have these national policies in place, is yung pagbaba sa LGU at pag-iintindi, ano ba yung nangyayari talaga sa LGU? what are the gaps and what are the areas we need to augment on, no? Malaking area ang Laguna, kung tutuusin. So, we need to identify, we're working, no, with our regional office, as well as the LG to identify more specific reasons bakit hindi niya masustain yung pagbaba. At sabi mo nga, ito na lang ngayon yung area sa NCR Plus na meron pa tayong nakikitang pagtaas ng mga kaso. I cannot fully answer that right now, Kat, but once we get that feedback from our offices, we'll provide that information sa inyo.
Ma'am, so far wala pa. Pero yung kahit po parang kumbaga overview lang, any idea on why, wala pa din po.
Generally, the report of Calabarzon, no, ang ating CHT, was really the loosening to the parang less adherence to MPHS, no? And they saw gatherings. May mga nagpa-party na, may mga nagpapa-social event na. And, once we increase the maximum capacity of workplaces, there's a tendency to already hold meetings indoor, no? Nagpapa-face-to-face na tayo. Yun yung general na information na nakuha namin para sa ating rehiyon. Pero yung specific to Laguna, that's something being identified right now.
Okay. Ma'am, last question for me po. Meron po bang order or push from the DOH to change or to make the vaccination protocols and other protocols, especially in the regions, stricter, considering na meron po tayong ganitong data and at the same time, there are growing reports of parang irregularities in the vaccination process?
I'm not sure what you mean by stricter, pero siguro kung how well we are doing the vaccination, we've always relayed naman, no, that in the deployment, it has to be safe, it has to be effective, no? At kasama din yung pagbabantay sa operations. Itong mga recently na mga nare-report na mga events ay ini-investigate natin. At ang maganda naman ay once na nakita natin to at ito ay na-refer sa LGU, agad itong na-address. No? Siguro isang i-konteksto natin ay mahirap, no? Mahirap talaga. This vaccination deployment we're doing is unprecedented across the globe, no? Ngayon lang natin ginawa yung mag-mount ng ganitong kalaking pagbabakuna, dami ng pagbabakuna. And along the way, we'll have some missteps. Now, what's important is we look, see, identify kung saan tayo merong mga pagkukulang at paano natin i-address yung mga pagkukulang. And that's what we're working with sa ating mga CHDs at sa ating mga LGUs.
Ma'am, sorry, i-qualify ko lang what I meant by stricter. Meaning, are you considering po sort of retraining the staff given nga po yung gantong reports?
Yeah. So, tama naman yun, no? Before we do deploy, no, ang atin namang sinisigurado is yung ating mga vaccinators, no, or anyone in the vaccination site, alam nila kung paano ibigay ang bakuna, paano yung magmo-monitor. Siguro nga, no, ang nabanggit nga ng ating mga butihing mayor ay potentially, if we're vaccinating from morning till evening, it must really be taxing. So, baka yun ang kailangan tingnan, no? How do we ensure that as we want to increase yung mga binibigay natin bakuna on a daily basis, how do we ensure, no, na na tama, no, yung pagbabakuna at tama yung pagmo-monitor sa kanila.
Thank you po.
You're welcome, Kat.
Kat, let's have Aiko for the next question. Aiko.
Yes po. Doc Thea, good morning po. Good morning po, Jolo. Doc Thea, sa presentation po kanina is wala na pong nakikitang nasa high risk when it comes to the healthcare utilization rate. Pero meron pong 3 regions na mataas po ang kanilang ICU, the 11, 6, and 2. Ano po ang nakikita po nating challenge kung bakit hindi po nila mapababa yung kanilang ICUH curve? Thank you.
Salamat, Aiko, no? Nung tinitingnan talaga natin yung mga ospital, klase ng ospital dito sa mga lugar na to, yung kailangan nating taasan pa is yung mga level 3, no? Mga tertiary level hospitals, mga medical center talaga, no, na ito usually kasi yung mga klase ng hospital na meron tayong ICU. So yung isang tinitingnan ng ating secretary along with the bureaus of DOH is paano kung level 1 at level 2 nga lamang ang mga ospital sa lugar na to, how do we convert the non-ICU beds into ICU beds? So yan yung pinag-aaralan para nga kung una nakahanda tayo kahit hindi pa ICU yan ngayon, paano kung biglang tumatami ang kaso? Paano mas mabilis ma-convert yon? At ikalawa, kasabay no, parallel nun ay talagang pagpapaigting, no, yung meron tayong health facility development plan talaga para mas may longer term na response tayo at hindi yung parang reactive, no, kung kailan dadami yung kaso, doon lamang tayo magdadagdag. So that improvement in our infrastructure will ensure that whether we have low, medium or high rate of cases, nakabantay na dyan, no, yung ating mga sapat na dami ng kama, lalo na yung mga ICU beds natin. And the One COVID Referral Center is working to add, convert additional ICU beds or install additional ICU beds in these areas.
Ma'am, with the conversion po ng mga ganun, hindi po kaya matagalan po yon before they can address po yung problem nila sa ICUs po nila?
O, alam mo, challenging talaga yung pag-convert, no? And I guess that's where some out-of-the-box thinking will have to happen, no? Kasi parang merong strict rule, ano ba yung isang ICU, gaano karaming tao. Pero I think yung sinasabi nga ng ating secretary, there could be some modification, no? To ensure na it will be able to provide these more specialized services to our severe and critical. Hindi ko sinasabing madali. It's really not an easy task. And that's one of the reasons we're having more challenges in adding ICU beds. But I think what COVID taught us is how to adapt. No? So sa ngayon, pinag-aaralan ng OCRC, ano ba yung mas epektibo, efficient na pamamaraan nga na either is it through conversion of non-ICU beds to ICU beds, or is it really adding, no, yung bago talagang mga kama at maiiwan silang mga ICU beds. We'll get back, no, we'll touch base, no, with our OCRC, and then we'll have Jolo give feedback regarding our efforts, no, in these regions.
Right po, Dr. Thank you po. Thank you, Jolo.
Right, next, let's have Raul.
Magandang umaga po, Doc. Gusto ko lang po i-trash out kung bakit we seem to be bucking the trend in the region, no? Gusto kong malaman kung we doing, kasi we don't seem to be doing anything special, no, except for the face shield. Kumpara doon sa ibang bansa, like, I mean, Singapore and Indonesia have tight border controls. They also have tight quarantine restrictions, no? So, we seem to be not doing anything special. Pero bakit tayo, why are we bucking the trend, no? Ang gusto ko lang po sanang is to give you a chance to say na we're not wala tayong outbreak hindi dahil sa hindi natin talaga na-detect itong variant dahil hindi masinop ang ating testing and contact tracing. And then walang incentive ang mga tao na kung mild symptoms lang na magpa-test. So, yun lang pa.
Raul, sorry, I didn't quite get that, no? Are we trying to figure out what do you mean by bucking the trend? Sorry.
I mean, we are seeing outbreaks of the Delta variant in nations like
And
Bangladesh, Indonesia, Singapore, and and we're not doing anything special compared to them, but we are bucking the trend. There's no outbreak of Delta variants here. So I'm just wondering, is there really no outbreak here, or are we not just seeing an outbreak because we are not testing enough, we are not contact tracing properly, and there is no incentives for people with mild symptoms to have themselves tested?
I think kung halimbawa sa poor na case detection, no, there's nothing different now to previous. In fact, nakikita nga natin sa datos natin, nag-improve tayo when it comes to how we improve, how we detect people, no? So that's why we monitor yung lab output natin. Are we testing people? Monitor natin kung naghahanap ba talaga ng mga kaso ang ating mga LGUs, kung nagkakaroon ba ng mga increase, no, na admission sa ating mga hospital at health facility. Yun, parte yan ng pagmamonitor to ensure na kahit na pababa ang kaso, sigurado ba ako, no? In epidemiology and surveillance, alam nyo, pag pababa yung kaso, mas mas on heightened alert kami. Kasi gusto kong mapatunayan na itong pagbaba ng kaso na nakikita ko, o di kaya minsan zero na kaso na nakita ko, ay totoong pagbaba at totoong zero. Doon yung opportunity to heighten surveillance. So I'm not saying it's perfect, but it's being done by our LGUs. And ikalawa siguro, alam nyo, if a variant of concern such as Delta comes in, I really feel we'll see that, no? Lalabas at lalabas yan, and it will be reflected in spikes in cases, in increased clustering of cases. At yun yung tinitingnan natin ngayon. At the Epidemiology Bureau, it's a medyo mas macro eh. It's a provincial, regional, and national level. But that's what we're asking our regions and LGs to do, na sila din may pagpupulis, may magpabantay sa kanilang mga lugar para kapag nakakita sila ng biglaang pagtaas, i-report sa atin yan at tingnan natin. Pero alam nyo, ito lang siguro, no? We don't want the Delta variant to come in. We want to delay its entry as much as possible. And that's why we're having the strict border controls. But we know na, eventually it will probably come in. Pero habang wala pa siya, this is the time for us to ensure that our strategies are in place. Our health system can take on whatever surge this Delta variant can potentially bring to the Philippines. And that's where our fast tracking ng vaccination comes in. Para mas resilient tayo, no, kung papasok man ang Delta variant or whatever new variant of concern na mahahanap natin in the future.
Maraming salamat po.
Dr. There's no more questions from the media. Maybe we have your closing message, Dr.
Okay, so again, no, salamat po sa ating media partners. It's always a pleasure, no, to have this weekly Kapihan with you because it's our opportunity to share, no, and to better explain itong datos na nakikita natin. Dahil tama kayo, no, mahalaga ang tamang impormasyon. Na narinig ko yon na hindi dapat itago kung may mga nakakatakot na balita tulad ng mga variant of concern such as the Delta. Pero kaakibat ng pagbibigay ng ganong impormasyon dito sa mga pagbabago, nakakapanibago na mga events sa COVID is yung paano tayo magre-react, no? It's always our reaction and how we manage our fear na makakatulong, no, at kumaga it will determine kung kakayanin nga nating makapag-respond, no? So the same three messages are there. It's really having strong LGU response, having safe workplaces and establishments, and again our own individual accountabilities to ensure that compliance to MPHS, getting ourselves vaccinated, which will really pull us through. So yun lamang, and salamat, magandang umaga. Thank you, Jolo.
That's it for our Kapihan today. Thank you, Dr. and everyone who joined us in our Kapihan. Ingat po kayong lahat and see you on our Friday Media Forum tomorrow.
Salamat, ingat. Thank you, Jolo. See you. Bye-bye.